You got to be happy. There's no reason to be sad. My name is Darnell Young, and I am a pediatric dentist practicing at Elm Family Dental. You know, my thing was, once I knew I wanted to become a dentist, is like how would I feel the most effective with my time being a dentist, and that was pediatrics because you give these kids a lifelong, lesson and learning and habits that they will carry with them throughout, and even if they don't come all the time, which I'm not encouraging, but they will say, I remember I went to the dentist and I saw Dr. Young, and even though it's probably been 5 or 6 years, or even I'm an adult now, I know it's not that bad. I'll go get this taken care of. So that's how I feel. I can make a difference, and that's why I chose pediatric dentistry over anything else. So I definitely can relate with the parents, and they know. So and there were certain things before my daughter was born that I was ignorant to, and you don't get it. Like if you're not a parent, there's just certain things you can read. You know what I mean? All you want about being a parent and childhood and all that, but just those things, the experience, and that helped out, twice as nice. She's 4. Yep. 5 this September. Obviously, that's one of the best things that happened to me in general was, my daughter being born. But it also helps being a pediatric dentist to know what the challenges are of kids not wanting to brush or having a fight with a kid that's 12 months to 16 months and they really don't want to brush, so I've been through it, so I can tell a parent, listen, I know sometimes they try to run, hide, don't want to open their mouth, but you do it and they get used to it. The younger you start, the easier it is for them to get used to it. I'm glad she was born, and I'm glad, you know, she's born and she actually helps me out in my line of work as well.
Yeah.
So.
And how old is she again?
She's 4. Yep. She turned 4 last September, so she'll be 5 this September. Yep. So.
And her name's Cyan?
Cyan.
Cyan?
Yep. Cyan. Cyan. Yep.
Yeah. And so that's really interesting because, like, you were saying how when you were growing up, your mom had a negative outlook on it.
Well, yeah, see, it was, you know, actually, my parents were pretty good about the dentist as far as not being scared to bring me, not saying they're not. It was more, they wouldn't bring me until there was a problem. You know, oh, this tooth is loose, this tooth hurts. It wasn't, you know, the maintenance. You know, it's like bringing your car to the shop when something breaks down and not getting your oil changed every, you know, 3,000 miles. You get your teeth cleaned every 6 months. It was more, you know, wait till something hurts. So that culture is changing a lot now. I would like to see it improve even more, but that's definitely, I say, one of the bigger differences now, is that more and more people are coming for maintenance, like routine checkups and cleaning. But I can say family members, I remember growing up, we would always be scared. You know, they always talk about the worst. Oh yeah, they have to take it out. The dentist's there to take it out. This hurts. They gotta give you a needle and all of that. So, you know, it's out there. That negative stereotype is out there, but it can be done effectively with, there's a lot of measures to deal with children's anxiety. Some kids aren't nervous. They might just need laughing gas or nothing. Other kids are nervous, so you give them laughing gas, or they might need to be sedated with something stronger. And if, you know, if there's special needs and they can't, you know, sit in the chair due to, you know, the mental, you know, disability, then we take those kind of patients and we bring them into the OR and we do comprehensive work all in one day and just make any problem we see, we correct it in that day. So there's something for everyone. That's what I think is different. The whole sedation side of dentistry is different than it was when I was a kid. You know, it was like, all right, this child is not sitting down. Let's get 2 other assistants in here. You grab this leg, this arm, that arm. I'll hold that, and we're gonna go until, you know, we're finished. So that has changed a lot, and that's for the better, obviously. You know, so I'm glad to be a part of that. Definitely see that difference.
Yeah, I can tell.
Yeah,
you have a good vibe about it.
It's a big difference than, you know, what was happening, you know, 20, 30 years ago. Big time changes.
Yeah.
And a lot of people aren't aware of that. That the changes are there, and they're not aware of the fact that, you know, a lot of people. So when you say sedation and then nitrous, and like, is this safe? Is this going to affect anything? I'm like, of course it's safe. The things you read about on TV is people overlooking certain aspects, okay? You know, if somebody comes in, you know, with like lung condition or airway condition and you do a sedation that's not in the OR and, you know, they stop breathing, well, you shouldn't have done that in the office. That kind of sedation shouldn't be done in a place like here. That should be done in a hospital, in the OR, where you're on a respirator, they're breathing for you, stuff like that. So all the things you hear, all the trouble, you know, kids, you know, adverse events, it's because there was a mistake made somewhere. You know, you rarely, I can't think of anything I've read in the newspapers or read in the journals that say, oh, this doctor did everything right, but this happened. It's always, well, why did you sedate this patient and they had, you know, Treacher-Collins syndrome or something like that, and you shouldn't have done it. You shouldn't have done that in the office. But either you rarely, if you follow the guidelines that the AAPD, which is the American Academy of Pediatric Dentistry, and the ABPD, the American Board of Pediatric Dentistry, put out, you will be fine. And that's what we want to hit home with parents. If they have to be sedated, it is safe. You know, no one's out there. Say, well, you know, it's a 50-50 chance your kid will make it through this. you know, this is safe. That's why we do it. If it wasn't safe, I wouldn't do it.
Yeah.
So, you know, that's the good thing about dentistry, the sedation aspect, definitely.
Yeah.
Big difference, big help. So.
Yeah. No, that's really good. You covered everything.
So, I mean, I don't know you need more, but I can, you know, I can talk forever. I want to keep you forever.
Right? No, it's a good topic to be passionate about. If you just want to state, you know, say, you know, my name is Darnell Young, and I'm a pediatric at Elm Street.
Okay.
Whatever you're.
Yeah. So I'll state it now. Okay.